If you've ever woken up, placed your feet on the floor, and felt a sharp, aching pain in one or both knees, you're certainly not alone. For many people, those first few steps in the morning are the hardest part of the day. The stiffness, the swelling, the discomfort, it can feel as though your knees have aged overnight. But what if the pain isn't simply a consequence of getting older? What if your body has been sending you signals all along? And by understanding those signals, you could begin taking meaningful steps toward feeling better naturally. Today, we're going to explore why inflamed knees often hurt most in the morning, what may be happening inside the joint while you're sleeping, and most importantly, the natural strategies that can help reduce discomfort, improve mobility, and support healthier joints over time. These are practical habits that many people can incorporate into everyday life without relying solely on medication. But stay with me until the end, because one of the simplest daily habits may also be one of the most overlooked, and it could make a surprising difference in how your knees feel every morning. During the night, your body naturally slows down. Your muscles relax, your circulation changes, and because your joints aren't moving, the lubricating fluid inside the knee becomes less evenly distributed. For people with osteoarthritis or other inflammatory joint conditions, this often results in stiffness that becomes most noticeable when getting out of bed. At the same time, your body's inflammatory processes follow a natural daily rhythm. During the early hours of the morning, certain inflammatory chemicals may become more active, while natural anti-inflammatory hormones are temporarily lower. This combination can contribute to morning stiffness and discomfort. The encouraging news is that movement is often one of the best natural medicines for stiff joints. Before you even get out of bed tomorrow morning, try spending just 2 minutes gently waking up your knees. Start by slowly moving your feet up and down several times. These simple ankle pumps encourage circulation through your calves and into your knees. Next, gently slide one heel toward your body, bending your knee as far as feels comfortable before slowly extending it again. Alternate legs several times without forcing the movement. Finally, tighten the muscles on the front of each thigh by pressing the back of your knee gently into the mattress. Hold the contraction for about 5 seconds before relaxing. Repeat several times on each leg. These gentle exercises activate the muscles that support the knee while helping circulate joint fluid before you place your full body weight on the joint. Many people are surprised by how much easier those first few steps become after only a few days of making this routine a habit. And that's only the beginning. Once you're standing, warmth can become your next ally. A warm shower directed toward your knees for several minutes may help relax surrounding muscles, encourage blood flow, and reduce the feeling of stiffness. Some people also find relief by applying a warm compress before beginning gentle morning activities. However, if your knee is visibly swollen after exercise or an injury, cold therapy may be the better choice. Applying an ice pack wrapped in a towel for around 15 minutes can help calm swelling. Knowing when to use heat and when to use cold is an important part of managing knee discomfort naturally. But here's something that often receives far less attention than it deserves. The food you eat every day can influence your body's overall inflammatory response. No single food can cure arthritis, but your dietary pattern can either support your joints or work against them. One of nature's best-known anti-inflammatory spices is turmeric. Its active compound, curcumin, has been widely studied for its ability to support a healthy inflammatory response. Consuming turmeric alongside a small amount of black pepper can improve the body's absorption of curcumin. Fresh ginger is another excellent addition to many meals and herbal teas. Research suggests that ginger may help support joint comfort in some people while also providing powerful antioxidant compounds. Extra virgin olive oil deserves a place in almost every healthy kitchen. Rich in beneficial polyphenols and heart-friendly fats, it forms one of the foundations of the Mediterranean diet, which has consistently been associated with better overall health and reduced inflammation. Fatty fish, such as salmon, sardines, mackerel, and trout, provide omega-3 fatty acids, nutrients that support cardiovascular health while helping regulate the body's inflammatory processes. Sardines, in particular, are affordable, nutrient-dense, and rich in calcium and vitamin D. Colorful fruits and vegetables also deserve a starring role. Berries, spinach, kale, broccoli, peppers, and leafy greens provide antioxidants that help protect your body's cells from oxidative stress. Nuts and seeds, especially walnuts, flax seeds, and pumpkin seeds, offer healthy fats and minerals that contribute to overall joint health. On the other hand, some foods may encourage inflammation when eaten frequently. Highly processed snacks, sugary drinks, excessive sweets, refined white bread, pastries, and frequent fast food meals may all contribute to poor metabolic health, which is closely linked with chronic inflammation. Alcohol should also be consumed in moderation, as excessive intake can increase inflammation while interfering with restorative sleep. Speaking of sleep, this may be one of the most underestimated factors affecting joint health. Poor sleep doesn't simply leave you feeling tired. Studies have shown that inadequate sleep can influence inflammatory pathways and even increase how intensely we perceive pain. Creating a consistent bedtime routine, limiting screen exposure before sleep, avoiding heavy late-night meals, and reducing caffeine later in the day may all contribute to better quality rest and potentially better mornings for your knees. Now here's something many people overlook. Your knee isn't working alone. Every time you stand, walk, climb stairs, or rise from a chair, the muscles surrounding your knee determine how much stress actually reaches the joint itself. Weak quadriceps, weak hamstrings, and weak glute muscles force the knee to absorb more impact than it was designed to handle. This is why strengthening exercises are among the most consistently recommended natural approaches for chronic knee pain. One of the easiest exercises requires nothing more than a sturdy chair. Sit down slowly. Stand back up. Repeat several times while maintaining good posture. This simple sit-to-stand exercise strengthens multiple muscle groups responsible for supporting the knee during everyday activities. Another excellent exercise is the wall sit. With your back supported against a wall, slowly lower yourself into a partial sitting position, not too deep, and hold the position for as long as feels comfortable. Over time, this builds endurance in the quadriceps without excessive joint movement. Even short daily sessions can gradually improve stability. But here's an interesting technique that has received increasing attention: walking backwards. While it might sound unusual, some rehabilitation specialists use backward walking as part of carefully supervised exercise programs because it activates muscles differently from normal walking while placing different forces across the knee joint. If you decide to try it, choose a completely safe, flat area free of obstacles, move slowly, and always make sure someone is nearby if your balance is uncertain. Never attempt backward walking in traffic or crowded public places. Let's also talk about body weight. Many people underestimate the tremendous forces that pass through the knees every single day. With each step you take, your knees absorb several times your body weight. Even modest, gradual weight loss can significantly reduce the cumulative load placed on the knee joints over thousands of daily steps. This isn't about achieving a perfect body. It's about giving your knees a little less work to do every single day. Another natural strategy involves massage. Gentle massage around the thigh muscles, calf muscles, and the tissues surrounding the knee, not directly over an acutely swollen joint, may help reduce muscle tension and improve circulation. Some people also find relief using a foam roller on the thighs or calves to release tight muscles that indirectly affect knee movement. Hydration also matters more than many people realize. Cartilage contains a large amount of water, and staying adequately hydrated supports many normal functions throughout the body. While drinking more water won't cure arthritis, proper hydration is part of maintaining healthy tissues. Certain nutrients also play supportive roles in musculoskeletal health. Vitamin D contributes to normal muscle function and bone health. Magnesium supports normal muscle and nerve function, while vitamin K participates in healthy bone metabolism. Omega-3 fatty acids help support a balanced inflammatory response. The best approach is always to obtain these nutrients primarily through a balanced diet whenever possible, and to discuss supplementation with a qualified healthcare professional if deficiencies are suspected. It's also worth remembering that not every painful knee has the same cause. Sudden swelling following an injury, inability to bear weight, significant redness, warmth, fever, or rapidly worsening pain should never be ignored. These situations deserve prompt medical evaluation to identify the underlying cause and ensure appropriate treatment. Natural strategies are excellent companions for maintaining joint health, but they should never replace professional care when serious symptoms are present. Here's something incredibly encouraging. Your knees respond to consistency far better than intensity. You don't need miracle supplements. You don't need impossible workouts. You don't need to suffer in silence while hoping things somehow improve on their own. Small, daily habits. Gentle morning movement, strengthening your legs, choosing more anti-inflammatory foods, maintaining a healthy weight, sleeping well, staying active, and listening to your body can gradually build stronger, healthier knees over time. Improvement rarely happens overnight, but every healthy choice becomes another investment in your future mobility. Imagine waking up weeks from now and realizing those painful first steps aren't nearly as difficult as they once were. That journey starts with today's choices. If you found this video helpful, let us know in the comments which of these natural strategies you're planning to try first. Your experience could encourage someone else who is dealing with the very same challenge. And if you enjoy practical, science-informed, natural health advice designed to help you stay active, energetic, and independent, don't forget to subscribe to Auralith Wellness. We're here to help you take simple, sustainable steps toward better health, one day, one habit, and one video at a time.